guys, my name's Paul, and today I want to talk about male issues. So, testicle pain, prostate pain, pelvis area pain, and I'm going to give you practical tips. Um, and the reason I'm making this video is because there's so much misinformation out there, so much stuff out there that doesn't actually help you. Um, a lot of bullshit basically. And I want to make this video because I've suffered with this for about 2 years now. And the truth is, there was no good information out there, nothing that would really help me at all. And there was actually a lot of stuff which, people want to believe but doesn't really work. So as well, I want to let you know I've got nothing to gain from this video. I'm not going to link you to my website. I don't have one. I'm not going to sell you any supplement or stretching routine sort of thing. I'm doing the video because I feel obliged to do it. I feel that, I suffered for so long. I don't want anyone else to suffer for so long unnecessarily, when it really is a simple fix. Not an easy fix, but a simple thing you can do. So I want to start by saying my condition was particularly prostate and so pelvis area pain around this area, and my nuts, which I'm not going to show you on camera, unless I re-upload this video on Pornhub or something. But it was particularly painful after I ejaculate, when I'd been aroused for a long time. And my nuts would basically swell up. The veins would become very prominent after ejaculation. It would be painful. And if you don't have the exact same symptoms of me, but you have pain around that area, don't worry. This video still applies to you, and you'll understand why. It's all part of the same thing, but different people have different symptoms. So I was very sexually active. And I've had chlamydia in the past. I've had urinary infections, and the truth is, when I was having this problem, in all my urine tests and blood tests, doctors would look at it and say, "There's nothing wrong with you. Like, it's all psychological. Get out of your head, man." And so because of that, I couldn't get treated. I'd taken antibiotics in the past, and they would help initially, but it would always come back. And, that would be on my record that I've taken antibiotics, and because of that, doctors would say, well, it must be in your head. Antibiotics didn't fix you for good, so, yeah, you're making it all up, which is nonsense. Now, I'm going to tell you what has actually helped for me. Even though I'm at the start of my journey, it's helped so much. And I want to start by saying it's an infection. So it's pretty much always an infection, unless you're having these types of pains and it's come from something that you're sure about, like, I don't know, you ruptured your prostate from riding a bike, or something like that, ridiculous, but I guess it happens. But I'd say 9 times out of 10, it's an infection. What doctors don't tell you is, just because you can't see an infection in your urine tests or your blood tests doesn't mean you don't have an infection. Doctors can't get their heads around this. And if you want to learn more about this, look into a guy called Professor Malone Lee in the UK, and another doctor called Dr. Bundrick, works at Arctelex Urology in US, but you can still do online consultations if you're not in the US. What was happening was, I was reading all this stuff, like, is stretching going to help? If I take saw palmetto, if I try supplements, is that going to fix it? Nothing fixed it. I didn't have any information. I didn't know what was wrong with me. Oh, my urine tests say I don't have an infection. So, there's no point going on antibiotics again, and you just feel helpless. It's terrible. And I imagine there's so many guys out there suffering. But the thing is, so after doing my consultations with both Malone Lee and Dr. Bundrick, it turns out, if you've got these symptoms and you're sexually active, or, even if you do anything kind of risky, even oral sex or whatever, it's extremely likely that it is an infection, but it's actually embedded into the bladder tissue wall, or it's inside the epididymis or the prostate, and it doesn't actually show on your urine test. So, but it's still there, and you've got to keep that in mind. And because of that, you've got to still treat it as an infection if you've got these sorts of pains. There is a way to know if there might be an infection, more certainly, which you can do. You have to do an immediate test of the urine and check for white blood cells. And if there's white blood cells that always above 0, if there's even 1, that means it's an infection. But this isn't your standard test. It has to be within 10 minutes. You've got to test the urine. For some people, you can do that. You can buy a microscope, or you can go to a lab and say you've got to check it immediately for any white blood cells. But if that's not an option, then you might just have to start on antibiotics anyway. Now, here's the thing. You need antibiotics for a long, long time. You need it, at least a year. That's the thing. Because antibiotics take a long time to fully eradicate the bacteria and to penetrate into the bladder wall, into the epididymis. It takes time, and that's why these 1-week treatments, 2-week treatments, even 1 month, your symptoms keep coming back, because it's not enough. Just because your symptoms are gone doesn't mean the infection's gone. The only way you'll know for sure if it's gone, you've done the white blood cell tests, and there's nothing, there's 0. So yeah, you need it for a long time, and that means you have to take an antibiotic at a high dose. That's key, not at a low dose, because that's more likely to build resistance. And you've got to you've got to take it for a long time. So it's got to be a safe antibiotic. So, ciprofloxacin, those sorts of drugs, the really strong quinolones, they give you immediate relief, but they're not practical because you can't take them long term. You can't take ciprofloxacin for a year. It's just gonna fuck you. So the one that men typically respond best to is doxycycline, so the tetracycline family, because that has good prostate penetration, and it kind of gets into the male urethra a bit better. So I'm doing 100 milligrams twice a day. It's only been 2 weeks, but that high dose of twice a day, not once a day, a bit more attacking than once a day, which is silly. No doctor should give you 100 milligrams once a day. So twice a day has just helped me so much, and I'm going to take this long term. Obviously, I'm going to update you at the end of the journey, but this is the only thing that's made sense from all my research. Is you've got to take antibiotics long term, because it is an infection. Obviously, I'm not a doctor. I'm not, I'm telling you what's worked and what's made sense for me. But, I have to say, for legal reasons, I'm not a doctor. Obviously, you've got to explain all this to your doctor. You can look into Malone Lee and Dr. Bundrick, but you've got to obviously explain to the doctor why you need it for such a long term, and you've got to get the antibiotics. They've got to be on board with what you're doing. But there's heaps of information out there if you look into the Professor Malone Lee and stuff. But yeah, that's the thing, is stretching, supplements, they might help a bit, but you're not really curing the problem, which is an infection. And yeah, I felt I have to make this video because I suffered so long, and yeah, antibiotics have been the only thing that has helped, and people want to believe that, oh, stretching is key, and yeah, you've got to take fish oil, but I think they want to believe that because they're worried about the effects of antibiotics, and antibiotics are going to ruin your gut and blah blah blah. It might affect your gut, but for me it's worth it to cure this problem. I'm willing to put up with a bad gut, and I'll take a strong antibiotic afterwards to fix it. But yeah, the truth is, the reason this keeps coming back, your chronic prostatitis, chronic epididymitis, which is pretty much what I have, is because you just haven't taken antibiotics long enough. Dr. Bundrick might say 3 months that you need antibiotics, which is still way longer than any normal doctor would give you. But me personally, I'm going to take it for a year at least, just to be sure that it never comes back. And yeah, that's what I wanted to let you know about. Is yeah, it's probably an infection, and there's not much information out there for men. There's heaps for women, heaps of women groups about chronic UTIs and how they need long-term antibiotics at a high dose, but nothing targeted towards men, because men don't talk about these issues as much, and we don't look into it. We just find something and we want it to work, so we stick to that. But yeah, men don't want to talk about health issues like women do. So I think you guys need some sort of support group and look into this type of treatment.